Hi, I'm Gabe.
Hi, I'm Vashida.
I'm Kelly.
We had a victory this week.
Yeah.
Yes.
It was good.
Yeah.
It was a really good victory. I mean, who would have thought, after all of this time, you guys want to spill the beans?
Capital Care got their license. Yay!
Woohoo! It's been 5 years.
It simultaneously happened like much longer than we anticipated and also much sooner than we anticipated. It's weird how
Yes.
that works.
Yeah, exactly, like that bitter, like not really bittersweet, but it's been, I guess, bitter trying to get them to renew the license, and now that sweet moment of relief.
Right.
It's done.
Yep. So this is the only abortion clinic serving all of Northwest Ohio.
Correct.
The entire corner of the state. And it was not able to provide surgical procedures for a couple weeks.
Right.
And basically had to start from scratch requesting a license to do so as an ambulatory surgical facility because the state Supreme Court ruled against them.
Yes.
Yeah, and then after that, the combined powers that be managed to procure the needed in quotes transfer agreement with ProMedica with the Toledo Hospital, and they're like, "Yeah, we did it," and the state of Ohio is like, "No," so they suspended, took away, denied, I don't know, got rid of their license.
Revoked.
That's the word. Revoked their license. So they had to.
Specifically, we mean the Department of Health.
Yes, not just like the state of Ohio.
And that order came from John Kasich. I mean, we know that this is not
let's
just
be realistic about it.
Yeah. This isn't Ohio Department of Health standard operating procedures. They're doing what the governor wants them to do.
Exactly. So, we were able to get the transfer agreement. So it's like, oh, well, let's find another way to stop them, another way to stop this abortion clinic.
Too late.
Yeah, from obviously providing the necessary procedures that they do on a day-to-day basis. So
right.
So Capital Care had to apply for a new license, and it took. I don't know if it took longer than it generally does for ambulatory surgical facilities because that's not my area of expertise.
I think part of the problem is that if they were an oral surgeon doing dentistry, they probably would have had this license like immediately.
Yeah.
They got inspected by the state. They went through all the steps, but the steps for all the other facilities either seem to go quicker when it's convenient for those other doctors in other medical areas, or things just happen constantly. So abortion clinics get inspected a ton, far more than all the other doctors do.
I mean, it's not just inspections. I mean, they also have to fill out the reports after every single procedure about like the results of the abortions, which it doesn't happen with any other medical procedure in the state of Ohio.
Right.
Not even births.
Right. They're facing all sorts of specialized restrictions,
jumping through hoops and
And in this case in Toledo, normally we try and stop them from having to jump through hoops by saying, hey, these hoops are illegal. In this case, we weren't able to do that. And so the clinic jumped through these hoops. They've done everything that's been asked of them. They have been providing safe and legal abortion care in the past. Now they can continue to do so because they've met John Kasich's onerous and we still maintain unconstitutional transfer agreement requirements.
Right.
Point of information, we were not able to do this successfully in Toledo, but it's still possible that it could be happening with Dayton and Southwest Ohio because that went to the federal courts, right?
Yes.
So the transfer agreement may still be declared unconstitutional as it is and has been in other districts, but it just did not work out for the Ohio Supreme Court.
Right. And part of the reason behind that is because when they filed the Toledo lawsuit, it started in
prior to the whole women's health decision.
Yes, thank you. And so now that decision has come out, and so now it can be included in
undue burdens.
Yes.
Yeah.
To show undue burdens in the current case in federal court, Cincinnati Dayton abortion facility. So we might yet still see transfer agreements struck down as the unconstitutional, medically unnecessary
restriction.
Yeah, that they are.
Or, setback that they are. Exactly.
Right.
But for now,
for now we have to comply.
Comply, but also we're happy that Capital Care is able to get back to doing what obviously the community needs. So
right. Yeah.
Yay.
We put out a statement. Our boss, Kelly Copeland, she was we were one of the first ones to know about this, and the first to put out a statement. Kelly said Toledo was a strong community with world-class healthcare provided by qualified professionals. Northwest Ohio has great hospitals, doctors, and nurses. Today, we're proud to see it again has abortion care provided by a terrific team at Capital Care Network. Toledo is a place that people travel to for excellent medical care, and this abortion clinic is a valuable part of those services.
Yes.
Yay.
Very good statement.
Kelly's been saying for years that Ohio is a medical destination state.
Yes.
And having abortion care is part of that. And so if we're going to be proud about our healthcare industry, then
that needs to be all across the board, not just certain healthcare needs that some may have, but the needs that all have. So, and then that includes abortion. So,
I mean, even with like the clinics closing and the restrictions that Ohio has compared to West Virginia and Kentucky and parts of Indiana and Pennsylvania, we are a destination.
Yes,
that is true.
We're a good destination to come to.
I mean, I agree, but if I'm coming to Ohio, I'd rather it not have to be because I have to travel 200 miles for an abortion.
Right. You'd want to come here for roller coasters and football.
Sure.
Right.
That's why you would come here, right?
No, it's all the strawberries.
Strawberries. That's a good answer.
Strawberry festivals. There's like 6 of them.
Okay, so the staff at Capital Care Network is obviously thrilled. They're able to serve the patients. That's their mission.
It's nice to still have a job.
Yes, that too.
We've heard from patients and clinic escorts. They're very happy to be able to continue to help people in the Toledo area. This definitely means a lot to people who rely on it.
Yes, absolutely.
Yeah. So that's not the only thing in the news. Donald Trump is going after Title X funding.
Yeah, I mean, this is something we see with every Republican administration. That you will reenact the global gag rule, which is
and expand.
Yeah, which is supposed to tackle like international funds and like restrict them for like referring patients to abortion clinics outside of the United States.
Having doctors even talk about abortion with patients. They're trying to ban, which is just absolutely crazy.
Yeah, the expansion with this is it's kind of enacting a domestic global gag rule, which is to say that for like doctors' offices, Title X recipients, like they can't refer or even mention abortion. So like this is supposed to be an attack on Planned Parenthood, but it's really any family planning provider, anyone who receives Title X funds. So that's gonna have a lot of like implications and problems for anyone who wants to do any sort of family planning.
That's absolutely right. I just got done listening before we started recording to a national press call with some of the Planned Parenthood heads of their national organization in DC. And so they were talking about the full impact if this, does get put in place. And I think the first thing is that this isn't a bill in Congress. This is an administrative rule. So
there's nothing we could really do about it.
People need to contact their members of Congress and they need to do their best to put a stop to it. I'm certain, because we've seen this exact thing before. Sherrod Brown, and many of our members of the House of Representatives here in Ohio, Marcia Fudge, Joyce Beatty, Tim Ryan, they've led the charge in saying, no, you can't do that. But now they need to talk to the administration. So it's important that your member of Congress hears you on this issue. 4 million people rely on affordable birth control and reproductive health care services through Title X. It's been around since the 70s. It was actually started by Richard Nixon, which I always think is like the weirdest thing ever.
I know, right? Go figure.
I had a class with somebody who argued that Richard Nixon was not a Republican. He very much was, but that just tells you how far right this guy was.
Right. Well, and this was supported through the Reagan administration. I mean, Reagan had the first version of his gag rule, so Reagan had problems. I'm not saying Reagan was good, but Title X was always seen as a non-political, non-political thing. This is just money for family planning healthcare. No one would go after it because that would be a dumb thing to do politically.
You'd think.
Right. And so now it's continued to grow. So you've got wellness exams, life-saving cervical and breast cancer screenings, birth control, contraception education, testing and treatment for sexually transmitted diseases, and HIV testing. That's the services through Title X that people get.
That's a large scope of services that people cannot afford to lose.
And a lot of that funding does go to Planned Parenthood, who does do and refer for abortions. So you're taking like one of the largest providers of family planning and just being like, nah, you can't have the money for it. So that's essentially just going to slash all of Title X funding, just in general.
Right.
Or you can give it to like, I don't know, county clinics that don't have enough staff and support to actually see all the patients who would need it.
Or offer all of these services to start with.
Yeah.
That was something that we saw the first time John Kasich tried to defund Planned Parenthood.
Just go to a dental clinic. It'll be fine.
Yeah, they were referring to dental clinics and saying, well, give it to those. Those are qualified, healthcare providers for teeth.
Which shouldn't be separate from like health insurance, but that's another discussion.
Right.
Oh, goodness.
It's in your body. It should be cared for by a specialized doctor who knows what they're doing.
Exactly, which is why they go to school for that particular field.
Right.
So again, make sure you contact your congresswoman or congressman and, voice your opinions. Make your concerns heard.
Did you guys see that the birth rate for the United States is the lowest it's been 2 years in a row?
I seen that.
Yes. Imagine that. Access to contraception compounded with like
access to birth control and
access to contraception compounded with like hostility and lack of resources for new parents. I wonder why the birth rate would be so low.
Well, that's one thing that I learned about in high school. We had a biology teacher that taught a whole unit on population studies, and so we learned like the Paul Ehrlich population bomb, all the early sort of oh no, there's too many people in the world, which
it's so funny you said that, because I was going to mention that, like, literally right when you said that.
Turns out that when people have control of their fertility, they have less children.
Right.
Do you think our country will ever get to the point where they start to implement like China did, how many kids you can and cannot have?
Well, I mean, our birth rate is low like because people want it to be low. It's not because
right.
I mean,
but I'm just saying, like,
there are people who are freaking out about this because they're like, oh no, there won't be enough people for Social Security. Haha, just kidding. The population in the United States is still growing thanks to all the immigrants that come to this country. So Social Security is fine. Which is puts another like damper on like Donald Trump's like plan. Oh no, get the immigrants out of here. Yeah. Wait, no, what about Social Security?
Because they're bad people.
No.
They're not people, they're animals.
No.
Well, that's definitely a point of religious and racial contention, and we see this from the kind of quiverful movement.
It's the white babies that we're worried about. There's not enough white babies being born in the United States.
Right. There's absolutely Christian conservatives across the state of Ohio and the country who think that strong white Christian families should each have a dozen kids. It's the Duggar mentality.
Yeah.
To maintain the American population with just white kids.
Yes.
And so then the other side of that is when they read these headlines about how the birth rate across the United States is holding steady or declining. And the headline that I read was saying that it had declined below replacement rate.
Yeah.
So it was, down below an average of 2 kids per 2 people. Right. And so they read that and they panic. And they freak out because then either, oh no, we're not going to have enough people, or, what you just said, the obvious solution is to allow immigration and, allow people to come to this country, do jobs, pay taxes, pay into Social Security, and we'll have no problems whatsoever maintaining a healthy working population.
Absolutely.
You just can't be racist about it.
Right. Also, I mean, I think people are realizing too that nowadays with so many services being taken away, it's expensive to have children.
Yeah.
Mm-hmm.
I mean, just to be real about it, it's not. Yeah, it's not cheap. I mean, the cost of daycare is through the roof. So
my cost of daycare is more than my mortgage, my car payment, and my student loans combined.
It's quite a bit.
That's crazy.
For a bambino.
Yes.
Yes. Not only that, the cost of my daycare is under market rate. So good for me, I guess.
Right. Exactly. So
yeah, it's astronomical to care for a child, and if anti-abortion, so-called pro-life groups wanted to do something serious about it, they would be advocating for
access to affordable quality childcare,
right.
Yeah,
access to parental leave. Like there's so many options that could make this better.
Stop introducing anti-abortion bills and lobby for more funding for Title 20, childcare funding.
I don't qualify for Title 20.
Yeah, we don't. And if in order to qualify, you have to make like $8-9 an hour and struggle and if barely make ends meet, but you have Title 20.
And if let's say you qualify at 20 hours, you will qualify up to 30 hours. But if you go up to 31 hours, you won't qualify. So if you go back to 26 hours, you still won't qualify. You'll have to go back to 20 hours. So you're like keeping people in poverty with the way the system is right now.
Absolutely.
And the poverty line is too low anyway. Hasn't been updated in entirely too long. But that's a different conversation for a different day.
Right.
Right. Back to this. So away from Title 20, back to Title 10. Okay, I got some stats here from Planned Parenthood. 2016. Health centers provided 700,000 Pap tests, more than 4 million STD tests, including HIV tests, nearly 1 million women with breast exams through Title 10.
Wow.
All of that is threatened now if the doctors who provide it do abortion referrals or work for facilities that provide both this Title 10 care and abortion care.
Yeah, that's unimaginable. I mean,
yeah.
We have problems with like the maternal health rate now. Let's just see what happens in a few years, I guess.
Right. Looking at Planned Parenthood specifically, there's 4,000 Title 10 funded health centers across the country. So those are Planned Parenthood and not Planned Parenthood. Anybody that's Title 10, 4,000 facilities, 13% of them are Planned Parenthoods. But the Planned Parenthood facilities serve 41% of all Title 10 patients. So basically 41% of low-income women seeking breast exams and cervical exams are going to Planned Parenthood.
Exactly.
That care right now, 41% of low-income women who get this care would have to find another doctor that's a Title 10 facility that, can give them an appointment.
Right.
Timely, because if you're looking at a cancer screening,
Yeah.
All of that is threatened because Donald Trump is realistically, he's listening to Mike Pence.
Yeah.
We're calling this the Trump gag rule, but really this is Pence's, his agenda that's just always been there.
Exactly.
Huzzah. So the
nobody ever thinks about the long-term consequences of these things. Like, I don't know what they do in the White House. Kind of like twiddle their fingers or thumbs.
They're looking at the short term. What can we do to guarantee that we get reelected to appeal to the
lives?
Yeah.
They have a primary goal. Yeah, they have a primary goal that is apparently better than any of their like second or tertiary goals. So
yeah. Sorry. We haven't done the "That's What She Said" segment in a while. So if our boss Kelly is listening, here's your "That's What She Said." Dawn Legans, the vice president for Planned Parenthood Federation of America, she was on this media call earlier. She said, "A president who does not know the difference between HIV and HPV should not be interfering in the doctor-patient relationship
at all."
Which is to say, that's what's happening. Our president does not know the difference between HPV and HIV.
Right. She said that quote on the call, and I could just like hear the crack of the bat. And I'm all about the sports metaphors and discussing women's health care.
Nice, Gabe.
Yeah, wow.
It starts at middle school, goes until you're, I don't know, almost 40.
Yeah. Donald Trump doesn't know the difference. HIV and
That's
HPV.
Sad. I mean, seriously, I can't even in my mind begin to Imagine that we have a president, he doesn't know the difference between HPV and HIV.
For listeners at home who may not know the
and
difference.
doesn't know what Bill Gates has been doing all these years.
Yeah, so the conversation about this is between the president and Bill Gates. Bill Gates does a lot of global health initiatives surrounding HIV, human immunodeficiency virus, which is the precursor to AIDS. And HPV is the human papilloma virus, also known as warts, not just genital warts, any kind of warts. If you have warts on your fingers, you have a type of HPV. There are hundreds, I don't know, thousands of varieties of HPV, some of which that cause cervical cancer. So these are very different diseases.
Completely.
That was a terrific explanation. I had to look it up. I couldn't have told you papilloma virus.
I know my stuff.
Yeah.
Yeah, I mean, Gardasil vaccine that is like offered to like young children, boys and girls.
I have my reservations, but I guess that's not neither here nor there. Moving on.
Okay.
It's a vaccine for the HPV strains that cause cervical cancer or other types of cancers, because they have found that HPV can also cause throat cancer.
Yeah. And so
men.
yeah, and you know, I've got two boys, and you know, they're a couple of years young, but in a short amount of time, when they're in their early teens,
it's usually recommended between ages 9 and 13, isn't it?
Yeah, so we're right in there. You know, my two boys can get the Gardasil vaccine, and you know, we will not be stopping them, because it's.
I just feel like I need to do more research because it's so new. And like they just came out of nowhere.
You should get your kid vaccinated.
I mean,
research.
My kids are vaccinated, but I'm just, I guess specifically, I can't even talk now.
It's really
talking about the HPV.
It's really
vaccine.
not that new. I got it when I was 20.
Did you?
Yeah.
Okay, so maybe it's just new to me because I feel like within the past few years is when I first heard about it, but like
there's been a lot of controversy about it because people who are like, oh no, if I get my kid vaccinated for HPV, they'll be more likely to have sex, which like
that is not a valid argument. Like
right.
Not at all.
I don't want my kid to have sex, so I'm going to put them at risk for cervical cancer. Are you out of your mind?
Yeah, you know, and
so you guys are. You got it. You're gonna get your kids done. And, okay.
Yep.
I don't know why I'm so skeptical.
Well,
I just have to do my research. I do research on everything. So, you know, rightfully so, you know, you want to know what you're putting in your kids' bodies. But my kids are vaccinated. They do have their vaccinations, you know, but we just have not hit that threshold of the HPV vaccine. And thank goodness they're still young. So have time.
When it was initially introduced, it was like marketed probably towards college students, but they started having it being introduced like before people are first like sexually exposed. So I mean, by the time you're in college, most people already have HPV. So
that is true.
That's the problem we're looking to prevent here.
Yeah.
So Bill Gates obviously has been doing HIV tests, programs, HIV prevention programs globally. And, you know, I think it's related that he gets into work to try and prevent HPV, and has had conversations with Donald Trump. And apparently every single time they meet, Trump has to ask the difference between the two. He doesn't know HPV from HIV.
I just find that hard to believe. Maybe he just doesn't know what HPV is. Like, how do you not know as a grown man and a father
who lived in New York City as an adult through the AIDS crisis?
Exactly, the difference. Like, that's just crazy to me.
Maybe he doesn't know that HIV causes AIDS and just thinks of it as the AIDS crisis instead of the HIV crisis. I mean, I'm just attempting to understand. Like, I've definitely made word mix-ups that do not go together but sound similar enough. So I can understand it from like that point of view. But who was in charge of leading a country, I do expect better.
I need you to know. And then if you've done it multiple times, that's a problem.
Yeah.
Right.
Maybe he's just worried that I've been told by my doctor that I have HPV. What does that mean? I have HIV? Maybe that's happening here.
Well, and his doctor, you know, there's so many controversies about his doctors lately. He's had the personal physician sort of whack job guy who wrote the fake letter about how he'll be the most physically fit president ever, which Trump basically dictated that letter, he's now admitted.
I don't know why you couldn't at least be like, well, yeah, he's healthy, instead of like, no, he is the most healthy he has ever been.
He was writing it. He said he didn't think anybody would take it seriously, and I didn't.
No, not at all.
He was right.
Right. And then he got assigned a military physician when elected president, and it turned out to be this Ronnie Jackson guy, who's an admiral, but yet accused of drinking in the job and creating a hostile work environment, and was going to be up for VA secretary. And everyone said, hey, wait a minute, this guy's just a personal physician and in no way qualified to be the secretary of the VA.
Yikes.
And earlier today, Trump announced the new VA secretary, like, as a surprise during a press conference, like, hey, so-and-so, you over there in the room, guess what? You just won VA secretary. He announced it during a press conference to the guy who didn't know he was getting the position.
Wow.
That's Trump's idea of, the VA provides medical, of a good time, of showmanship. But the VA runs so much healthcare for millions of Americans.
Absolutely.
And it's not really like the best, it's not the best run.
It's had significant problems over the past couple decades. Yeah.
So maybe we should put somebody in charge who knows what they're doing. But that's just me speaking.
Right. I mean, he goes to so many like CEOs of companies to do things.
Right.
The VA, I want, like whoever controls FedEx or UPS and does like logistic works, or runs massive, whoever runs the Cleveland Clinic. I want that person to go to the VA. If you run systems built on efficiency, where you're delivering care, no pun intended with delivering the FedEx thing, but you need to know how to run a big system with many moving parts.
Exactly. One
that should be the VA
already
secretary.
Kind of broken and needs to be fixed. So definitely has to be somebody who is willing to take on that job and put in the work. But that never really resonates with Trump. It's just like, oh, hey, how about you do the job? Hey, you riding the bike. Would you like this job? Like, just random.
I feel like you need to be given the option to turn something down instead of just like having it announced at a press conference, like la da da. Like it's just because it's the title does not mean it's something that is wanted. It's not a grand prize. It's not a cruise. It's just like it's a job.
You're up.
You guys watch You're the Worst?
No.
Okay. It's a show where every character is a garbage human being.
Okay.
But there is one character who is a veteran, and it like kind of chronicles it's like a side part of the show. And it chronicles like his issues and like dealings with the VA, and it's really upsetting.
Interesting.
Yep.
Robert Wilkie is the new VA secretary. He's been the acting VA secretary since March. But yeah, Trump came to the podium and says he doesn't know this yet. I'm sorry that I ruined the surprise.
Oh my God.
Oh goodness, there's lots of sighs. What do you say?
It's the publisher clearing sweepstakes, but with jobs.
Right.
Very big jobs with lots of responsibility.
Robert Wilkie.
Come on down.
Yeah. You're running the VA. Okay.
Yes.
We did That's What She Said. The Walk of Shame this week goes to Tom Brinkman.
Yes. I don't know what house district he's from. I don't know.
I'll look it up. You keep talking.
Okay. He introduced a house bill this week that would require any student that comes out in the school, and this could be gay, bisexual, genderqueer, transgender, any flavor of that variety, has to be they have to tell their parents. They have to inform their parents that this child has come out, which could end up with lots of students being killed or disowned,
committing suicide.
Yeah,
which has happened in the city of Cincinnati.
Exactly. Emotional stress and
Leila Alcorn. Yes,
there was a high-profile instance of suicide following a young teenager transitioning and
being outed.
Mm-hmm.
Yeah, having a terrible time with their parents.
And this bill not only requires mandatory reporting for being in mandatory information to parents of to out the child, but also states that the child cannot be removed from the parents' care should the parents refuse hormonal transition, hormonal care.
Yeah. So basically,
Let's just ruin some students' lives. It's fine.
yeah.
Yeah. Tom Brinkman is a Republican from Mountain Lookout, which is a Cincinnati suburb.
Okay. So, right where somebody was outed and then committed suicide. Cool. That's a great use of your time and a great use of self-awareness, which you do not have.
Right. Yeah. Just a horrible idea.
It is.
I mean, school for a lot of these LGBTQ students is kind of a safe space away from home.
Absolutely.
And these teachers should be like people you can go to, trusted authority members who aren't gonna like out you to your parents.
Or judge you or shame you or just any of those things that this bill is doing.
I mean, you're just trying to figure yourself out at that point. And it's just like, well, I think I might be bisexual, but now my parents know and I can never, ever even question this because they're going to disown me if I even bring it up.
Right.
So
yeah,
you're keeping people out, or you're keeping people in the closet until college or longer.
He's interjecting government in a place where it absolutely does not belong
at all.
And that's, disgusting and ironic that Republicans do that.
Exactly.
Yeah. They don't want government interference anywhere except for the places where it really should not be.
Like my uterus.
Right. For these kids' kitchen tables.
Absolutely.
So, okay, Tom Brinkman, walk of shame.
I mean, he's trying to force conversations before they're ready to happen.
Yeah.
Yeah.
Okay, what's happening on the events calendar?
Next Tuesday is the May Reproductive Health Happy Hour in Columbus. That'll be at St. James. It's a benefit for Planned Parenthood. I will not be there because I will be doing training in Cleveland, but if you're in town, by all means. I don't know what happens after that.
On May 24th, so Reproductive Health Happy Hour is May 22nd. May 24th is an event that our friends over at the Ohio Religious Coalition for Reproductive Choice is putting on. It's called Holy Callings, Advancing Reproductive Health. Yes, with Planned Parenthood. Holy Callings, Advancing Reproductive Health and LGBTQ Justice. That's going to be at the Holiday Inn downtown in Columbus. Information for all of these events, of course, is on our Facebook page or in the show notes. That's May 24th, and then June 2nd, Pride season begins in Dayton.
Yeah, you can come table with me. It'll be fun. It's a pretty short Pride. It's only 4 hours. Yeah. Each of the shift is 3 hours, so you can help set up and break down with us. It'll include a T-shirt for your time. It'll be fun.
It's a nice Saturday afternoon in Dayton.
Yep.
Also, that same weekend is Pride in the CLE.
Mm-hmm.
Hannah, your counterpart in Northern Ohio, is going to be doing that in Cleveland.
Yep. And then the Sunday after is going to be our Pro-Choice AF tie-dye party here in Columbus. So if you want a tie-dye party with us, it's something you can do. It's $15 for a T-shirt or a tank top, and it includes all of the materials to tie-dye. And we'll have a potluck, maybe a cookout. It'll be a good time.
Yes, so please come and join.
Yeah.
That's Sunday, June 3rd, here in our Columbus office.
Yes.
June 5th is an event called Female as F. I think it's supposed to say female as fuck.
Can't say that on the radio.
I'm past the radio time cutoff. So that is featuring many local comedians that are terrific, including Brooke Cardis, who's one of our friends and regular podcast guest.
Yeah.
Regular twice. She needs to come back. That's going to be at Backstage Bistro on June 5th.
I'm on that show.
Yay.
Yeah. But it's also sold out.
No,
just
okay.
FYI.
Well,
yeah, it's a benefit for Planned Parenthood. It'll be a good time. We just did this last Tuesday. Nope, just kidding. This past Tuesday, as in this week. It was also sold out. It was also a good time. Also, I don't think it's on our calendar, but May 31st is going to be the next Reproductive Health Happy Hour in Cincinnati.
Very cool.
Yeah.
Okay.
Cool.
Sounds good. Links for all the information in the show notes, and we'll see you next week.
Bye.
Bye.